This is tutorial number 2, endoscopic navigation of FES. When initiating any FES related exercise, it's important to understand that the looser the wheels are, I find the closer it is to the actual scoping experience. I've heard specific thoughts on this particular exercise. Try to maintain an understanding and memory of the loops or the twist and the torque that you're putting on the scope. So you could be rotating the scope twice on the right, for example, 2 full turns, and not realizing how far along to the right you can be until you reach the final target, the finalmost target, which will exhaust almost all your scope and can be difficult to obtain unless you've maintained a relatively neutral scope rotational position. That is, despite the fact that we naturally want to rotate clockwise, sometimes it's easier to just rotate counterclockwise. When beginning to practice for the FES or for scopes in general, I believe the endoscopic navigation module is probably the most useful one for one to master. It only takes about 15 to 20 minutes to practice it initially. It can be painful, especially on the wrists, but with time, those times can get to as low as 3 minutes or even lower, as you can see in the current video. And it's a very nice exercise that with spaced repetition, perhaps 3 times a week, somebody can maintain and even improve their endoscopic navigational skills, which is 90% of the experience in the real world. Of course, skills such as instrumentation and blowing air or sucking fluid or even cleaning your lens, those are not skills that you can learn from the simulator. But again, I believe that 80 to 90% of the navigational skill can be attained by maintaining a very good practice regimen and doing it very frequently.